Hello everyone, and welcome. I'm excited to kick off today's presentation with episode 9. This is our opening slide, so I just want to take a moment to greet you all and share what we'll be exploring today. We'll go over some key insights and highlights related to episode 9, and I'll give you a quick preview of what's coming up next. So, let's get started and dive into what promises to be an engaging session. So, on the second day after a myocardial infarction, we're looking at what kind of outcomes we can expect for the patient. One key point is whether the patient can perform self-care activities without pain, which is an important indicator of recovery progress. However, severe chest pain would not be expected at this stage, as pain should be decreasing if the treatment is effective. Another critical aspect is whether the patient can recognize the risk factors for a myocardial infarction. While this is essential for long-term management and prevention, it might not be the immediate focus on the second day. Finally, participation in a cardiac rehabilitation walking program is a realistic and beneficial goal at this point. Early mobilization and participation in such programs help improve recovery, prevent complications, and promote cardiovascular health. So, the most appropriate expected outcome here is that the patient can participate in a cardiac rehabilitation walking program, reflecting progress and readiness to engage in physical activity safely. This ties into our overall theme of promoting recovery and functional independence after a myocardial infarction. Today, I want to focus on an important milestone in recovery, being able to perform self-care activities without pain. This means that the individual can manage daily tasks like dressing, grooming, and eating independently, which is a huge step toward regaining independence. When someone can do these activities without discomfort, it not only improves their quality of life, but also boosts their confidence and motivation during recovery. Achieving this level of function indicates significant progress and often reflects that the treatment plan is working effectively. It's a key indicator that the person is moving toward full recovery and regaining control over their daily life. On the second day after a myocardial infarction, or MI, the patient is typically in what we call the early recovery phase. During this time, the main goal is to see a gradual increase in the patient's activity tolerance. This means they should be able to do more with less discomfort. An important indicator of progress is the absence of chest pain as they increase their activity. This stage is crucial because it sets the foundation for safe, steady recovery. It's all about carefully monitoring the patient's response and encouraging movement that promotes healing without overexertion. Remember, the overall aim here is to support the patient in regaining strength and confidence in their activity levels while ensuring their safety. By day 2, the goal is that chest pain should be either relieved or at least well controlled. This is an important milestone because it indicates that the patient is responding to treatment and their condition is stabilizing. At this point, the client is typically able to perform light self-care activities, such as feeding themselves or washing their face, without experiencing pain or difficulty breathing, which is also known as dyspnea. This ability to perform basic activities without discomfort shows that their hemodynamic status is stable and that they are on the path to recovery. Recognizing these signs helps us confirm that the patient is improving and that their heart and circulation are recovering as expected. Let's go through the options. First, severe chest pain is a serious concern because it could indicate complications or ongoing ischemia, which is not expected at this stage. So, if a patient reports severe chest pain on day 2, that's a red flag that needs immediate attention. Next, recognizing the risk factors for myocardial infarction is an important part of discharge teaching. However, this isn't something we expect the patient to be able to do on day 2 after their procedure. It's more of an educational point for later. Then, participating in a structured cardiac rehabilitation walking program usually happens later in the recovery process, not on day 2. It's part of the ongoing rehab, but not something we expect to see at this early stage. So overall, the key takeaway here is that severe chest pain at this point is not normal and needs prompt evaluation, while the other options are more related to education and later stages of recovery. Now, in the early post-myocardial infarction care, the main focus is on managing pain, promoting rest, and gradually helping the patient return to basic self-care activities. It's important to remember that during this period, the patient should have no symptoms before resuming normal activities. This approach helps in preventing complications and supports the healing process. The key nursing concept here is to monitor the patient closely, ensuring that pain is controlled effectively and that they are not experiencing any new or worsening symptoms. Rest plays a crucial role in allowing the heart to recover without unnecessary strain. As nurses, our goal is to guide patients through this initial recovery phase safely, encouraging gradual activity while being attentive to their comfort and stability. This careful balance is essential for a successful transition from acute care to longer-term recovery.